by 2030, 1 in 5 Americans will be 65 or older, and as healthcare needs rise, accessibility becomes critical. But what if we could deliver faster, cheaper, and more efficient healthcare to millions of people right in their homes? With the right partners, you can. But first, let us introduce ourselves. My name is Jason Ulrich, and with me we have Ava Pivovar, Tamai Potu, Daniel Serrano, and Krista Reynoso. We at QD Consulting have done the research and analysis, and we've narrowed down our recommendations to partner with Humana and Blue Shield of California. Dispatch Health's success hinges on aligning with organizations that match its goals and values while also showcasing financial viability. And no one aligns with Dispatch's goals as well as Humana and Blue Shield of California. Highlighting their financial attractiveness, demographic fit, shared goals of expanding home-based care, reducing costs, and improving patient outcomes, Humana and Blue Shield of California are the perfect fit. Together, these partnerships offer Dispatch Health a path for scalable growth and operational efficiency. First up, we'll have Ava get into how will Humana and Blue Shield fit in with Dispatch Health's financial goals.
Thank you, Jason, for that introduction. Now let's look into the financial impact and strategic advantages of our partnerships. We chose a Medicare/Medicaid focused and a private insurance partner to balance government-backed stability with higher private insurance profitability, while considering the key trade-offs like contribution margins, scalability, and long-term growth. First, we examined Medicare/Medicaid partnerships. On the left of the slide are the companies with government-funded programs. First, with Optum United Healthcare and Intermountain, they failed to cover Dispatch Health's variable costs, leaving Humana and WellMed Florida and Texas as the top options. However, WellMed's geographical limitations limited scalability. Humana emerged as the best choice, despite lower margins. Its nationwide presence of 17 million members ensures higher patient volume, broader market reach, and long-term growth, long-term revenue stability. Now, shifting to the private insurance, where higher reimbursements drive greater profitability. On the left of the slide, on the left are the companies that have private programs. We first ruled out Optum United Healthcare for its low margin and failing to cover variable costs for Medicare. Kaiser was the next option that was eliminated due to its lower margin and closed network, which limited scalability. Intermountain, despite its $4,500 reimbursement, was ruled out due to its negative Medicaid margin and limited Dispatch Health presence within the mountains, making expansion costly. We ultimately chose Blue Shield of California for its 80% contribution margin, no admin fees, and $3,200 per visit retained revenue. Maximizing profitability while limited to California, their 4.8 million members and high senior population allows for seamless integration and immediate scalability without major infrastructure investments. Now that we've covered the financial rationale behind this decision, I'll hand it over to Daniel to discuss long-term growth potential and how we will scale this.
Thank you, Ava, for talking about the finances. When looking at long-term growth potential, it's crucial to align with companies that not only have a strong market presence, but also demonstrate a commitment to innovation, but also improving patient outcomes. That's why Humana and Blue Shield stand out as top recommendations for long-term growth potential. Humana is an ideal partner because of its rapid growth rate, but also for the long-term sustainability. Their ability to negotiate with different private insurance companies positions them for future reimbursement opportunities, which also strengthens their financial outlook. As an equity shareholder in Dispatch, Humana can go ahead and leverage their success while also continuing to expand their footprint in home-based care. In the last year alone, Humana has added 840,000 new Medicare members, which is outpacing many other different competitors and also reinforcing its position as an industry leader. Moving on to Blue Shield, they offer excellent opportunities for expansion. With already having 4.8 million members, their market presence is already very significant. But beyond that, their strong equity stake in Dispatch Health allows them to invest in different growing home-based care sectors. Furthermore, their partnership with Blue Cross Blue Shield creates additional pathways for innovation in the healthcare industry. With such strong growth potential from these partnerships, the next key factor to consider is who will benefit the most from these advancements. Understanding our target market will help us guide strategies to meet the specific needs of the populations we aim to serve. Now we will be having Krista, who will be taking a closer look at the demographics and characteristics that define your ideal market.
Thank you, Daniel, for explaining long-term growth potential. Dispatch Health must align with organizations whose patient demographics closely match your service model. Humana and Blue Shield present ideal opportunities because their members fall within your target market. This alignment is so critical because providing care to patients with manageable medical needs ensures efficient services and better resource utilization. Treating patients within your target market allows for fast, high-quality care and reduced hospital visits. Many patients struggle with healthcare access due to location, mobility, or other barriers. And by working with insurers who can cover a large aging population, we can bridge that gap and provide care directly into their homes. Blue Shield of California has approximately 4.8 million members with the average age of 70 years old. While some reside in safe neighborhoods with good food access, others face barriers like unsafe areas and food deserts, increasing the need for accessible care. Humana has approximately 17 million members with an average age of 60 years old. Most patients live in safe neighborhoods with access to quality food. This supports overall health stability and is highly advantageous for Dispatch Health because it allows for greater focus on preventative care. With both channels, the average patient takes less medicine than Dispatch Health. Blue Shield has an average of about 10 medications per person, while Humana has an average of about 3 medications per person, in comparison to Dispatch Health, which has an average of about 15 medications per person. This makes service delivery more manageable and timely. Both partners give Dispatch Health access to a large aging population with relatively low clinical complexity, ensuring efficient operations, improved patient outcomes, and strong market expansion potential. With this clear need to align with the right patient demographics, let's look at how Humana and Blue Shield fit perfectly into this model. Their patient populations not only match our ideal demographic, but also enable us to deliver care more efficiently and effectively. Tanmai will now explain why these partnerships make sense.
Thank you, Krista, for going over the target market harmonies. In the aligned interest, I'll be explaining why Dispatch Health, Blue Shield, and Humana make a great fit together and how Dispatch will greatly benefit from this partnership. Humana brings to the table a Medicare and Medicaid focus, and then Blue Shield brings the focus for the private sector of the market. This means that the patients in the entire market will be focused on by Dispatch Health, and this means that Dispatch will be able to hit a target market they may not have had a chance to in the past. There's also three other interests that the three companies share, which is reducing social determinants, reducing costs, and improving delivery and its innovation. These three goals are in line for all three companies and will allow them to excel in the future if they continue with this partnership. All three companies have a commitment to preventative and value-based care, which means that they want to treat their patients and avoid excess and unnecessary visits to the ER. They avoid a fee-for-service model, but would rather work on preventative care and improving in-home based care. This means that they can treat their patients for high acuity and chronic conditions while creating comprehensive treatment plans that are ultimately better for the patient and their care. WellMed has a high number of high acuity and chronic condition patients, but the partnership that Dispatch Health will be making with Blue Shield and Humana will allow them to also treat those patients with better in-home care and technology that Blue Shield will be bringing. In the long term, the partnership that Dispatch will be having will come with many benefits. This means that the market is going to grow rapidly and there's a better chance for market penetration because Dispatch will be in almost every home of the US. This also means that there is value-based models seen in a lot of homes. There's better in-home treatment, and this not only lowers the cost for patients, but also for the providers themselves. Blue Shield also has a lead in technology as they have their foot in the door with predictive healthcare models and are looking at creating database care models. This ultimately reduces patient risk and is helping Dispatch Health and Humana with this partnership. Kaiser Permanente is already seen doing this, but the partnership that Blue Shield will be making allows them to have new patient data and a chance to create a newer, better model. Dispatch Health will be greatly benefiting from the partnership with Humana and Blue Shield, and there is also benefits that both companies will also be getting. Now, Jason, could you put the bow on this healthcare model, this healthcare package?
Thank you, Tamai. To recap, Dispatch Health's success relies on partnering with organizations that align with your goals and values while also providing financial attractiveness and growth potential. With this being said, Humana and Blue Shield of California are the ideal partners. Healthcare isn't just about treatment, it's about meeting patients where they are. And with the right partners, you won't just be changing how care is delivered, but you'll be changing lives. Thank you.